transport and social equity. This is actually what I try to address every day to provide access, especially to our low income residents of Windhoek. So, yeah, I'm looking forward to contribute. Thank you.
Thank you so much, Johanna. Please, can you tell us your country? You said Windhoek. Where is Windhoek?
Yes, thank you, Doctor. It's good you asked that. So Windhoek is the capital city of Namibia. Namibia, it was formerly known as Southwest Africa.
Our
So
South,
we are down in the south.
beside South Africa, right? Or above South Africa?
Yeah, Southwest Africa. It was known as Southwest Africa.
Southwest Africa. Okay,
Yeah, but
that's
we are Namibia, bordering Botswana, South Africa, Zambia, Angola, Zimbabwe.
wow. Thank you for that geography lesson. Thank you. Let me now invite Tokunbo to also give us a bit of introduction and his expertise and experience so far in transportation or public transportation.
All right, thank you so much, Dr. Emmanuel. Hello, everyone. Thank you for coming on board. Thank you for joining this discussion. So, my name is Tokunbo Laito. Currently, I sit as the CEO of Eonsfleet, a fleet infrastructure technology and fleet management solution company right here in Nigeria, Africa. And we are dedicated to sustainable and equitable transport solutions. So, with over a decade of experience in public transportation policy, planning and operations, also technologies around. I have personally worked to promote social equity and environmental sustainability in the transportation system. I've collaborated with government, NGOs, and private sector organizations to design and implement transportation solutions that prioritize social equity and environmental sustainability. So today, I'm excited to share my insights and also to learn from experiences from everyone here as we explore the critical intersection of public transportation and social equity. So like I used to say, let's work together to create a more just and equitable transportation future for all. Thank you.
Thank you so much, Tokunbo. It's a pleasure to have you here. So we're talking about geography. I guess everybody knows where Lagos is. Lagos is in Nigeria, right?
Yes, yes.
So at least we have Lagos here, Nigeria, we have Namibia. Dr. Fidelma will be joining us very soon. But till then, let me just do a bit of introduction about myself. Uh, Often there is this confusion when I tell people I'm in transport because they think I should be in an engineering or civil engineering or supply chain. But my transport interest actually from a business perspective, where we see transportation as a service, and more importantly, looking at it from a transformative perspective. That is not just providing a service, but providing a service that is accessible, a service that is equitable, and also using technology. So my first degree was in architecture, and that was why I got so much interested in the built environment. But I guess since I came to, I've joined the business school. I guess my perspective seems to have changed from just the design of this transportation system into actually looking at it as a service. So how can we make sure that people are using this service as best as possible? Thinking about maybe people with disabilities, people with vulnerabilities. What are we doing to make sure that yes, transportation, so for example, in this case, public transportation aligns well with that social equity. So it's a pleasure to be here with all of you, and also for those of you who are joining us. I also noticed that we've got a divide. We've got the practitioners, which is Tokunbo and Johanna. These are in the practice side, while I also share the same interest as academia with Dr. Chinebuli. So I think it's always nice to have that combination. So we are not just talking from theories, we are also talking from practice. So nice to have you. So for those of you who are joining us around the world, thank you so much for your interest. We hope you have your questions as we go on with this conversation. But we just want to dive into the whole activity for today and ask the panelists some questions. I will start with Dr. Chinebulu. Yes, with your experience and with the research you carried out around the world, how can public transportation system be redesigned to better serve the marginalized communities and address maybe any form of inequalities in access to transportation? So we're just looking at how do you think this could be redesigned? So imagine we are trying to colonize Mars. If we get to Mars, what should we do differently? So you get what I say, right?
Yes, I do. Thank you very much. So, to redesign the public transport system to better serve marginalized communities, I will be citing examples from some of the projects, research projects we have conducted in the past. For example, I would usually start a project by asking questions. That's what I call something like community engagement, engaging with the users. If we are going to redesign this transport system, if we are going to redesign this service, what would you want us to do? You know, when you talk to users, when you engage users, you tend to gather lots and lots of information which should be considered in the research. So, for example, when we conducted a research around mobility for older persons in Uganda and Nigeria, we somehow got in touch with the National Senior Citizen Center in Nigeria at towards the end of the research. So we had an inception workshop where we invited them and discussed this with them. If we want to redesign this, what would you want us to do? What would you want us to do to improve the services? So there is also something we call needs assessment. So you go through needs assessment to identify specific mobility challenges for different users. You know, we have so many categories of users, transport users. So maybe we'll just call them road users. We have young people, we have children, we have older persons, we have people with various forms of disabilities, and we have different diverse category of road users. So when we are trying to look at these things, we tend to look into their needs. If I am not able to get into this bus, what would you do to improve that aspect of my mobility? What would you do to make it easier for me to get into this bus? We also look at route optimization. If I want to redesign a transport system, I would tend to look at extending routes to undeserved areas. You know, there are places it will take you God knows how long to walk to, or the number of
Yeah.
kilometers you walk before you can access transport. And that's where I'll maybe divert a little bit. You talk about transport poverty. You're not able to access the transport you need for whatever needs you want to get to the hospital, you will not be able to walk to that distance to get on that transport, to get the transport you need. So we look at frequency of improvement. How frequent are the services? Do they come once in an hour or 2 hours? I traveled to Ghana, I think around February, and somehow I can't say what happened to the transport, and then I had to get on the bus. I can't remember how long it took us to travel the whole distance to Cape Coast. So you see this kind of thing. Sometimes you are just able to get transport services once in an hour or once in 30 minutes. So this should be looked into when we are redesigning. Remember, we're talking about redesigning, not even developing new ones. It's also important to look at affordability. Are people able to afford this? Should these be subsidized? If this we have pensioners and older persons, should we subsidize transport for them? What of children and all that? We also look at infrastructure investment. These are very, very capital intensive.
Yes, true.
For example, the first point I mentioned was needs assessment,
Yes.
engaging users. Before we recommend infrastructure improvement, we should make sure there should be feasibility studies, fine, but we need to discuss
talk to people, engage people who would need those services,
mm,
so that we don't end up, investing and spending all the money, and then nobody uses the service. So these are very, very capital intensive, and this is one of the reasons we don't see infrastructure around, infrastructure for all these services. So we need to ensure that both vehicles and infrastructure are fully accessible to
that's true.
everybody, different groups of people.
Mm.
We
Okay.
also, okay, is my time up?
Oh, no, 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 no. I was just
Okay.
reinforcing your point.
Okay, and then I'll bring in my safety improvements, which
Yeah,
is very, very important. Talk about safety. We try to, and then if you're looking at infrastructure, because part of my research is also making recommendations for infrastructure improvement. If you're talking about infrastructure, we'll talk about lightning, we talk about security and at transit stops and stations, and also making sure that people, even because sometimes you need to walk from point A to point B to be able to access public transport. It's not like we can just come out from our houses and then we get on a bus or a
mm,
taxi. And so we need to make sure that the path and the routes are, you know, very safe and
okay.
then easily accessible, so that everyone. Oh, I'm not concentrating on any particular category of user.
Users,
I'm talking about everybody. So
everybody.
when we are redesigning this, we need to bring representatives of all these people to the table and then discuss. It's not like we're going to, take everything from them, but we can consider the most important aspects of what, because if you don't, when we do research, we do what we talk, we sometimes use go alongs. So
So,
when you do a go along interview, you have your pre-developed form. But when you work with maybe an older person, you find out that even what you're doing in your sitting room, preparing your research
mm,
methodology, would be different from what you see in the field, because the
okay.
time it takes them to get on the bus, the time it takes them to sit down, walk from here to here, and all that, you begin to understand the challenges they face accessing public transport. Thank you.
Thank you so much for that detailed answer. I'm sure if you have about 30 minutes, you can still go on. But
Yes, I have like 10.
yo, don't worry, don't worry, don't finish it now. Like I, I,
Okay.
would, I would like to bring Johanna in to really talk to us about some of the innovative strategies, because I remember how I got to know Johanna. She was doing something around, I think we talked about transport fares and using technology, cashless payment. And it's nice to really know that there are some strategies, but that is also what we need to think about. Maybe we also want to reflect on your point, Dr. Chinebulu, about even the cost subsidizing transportation. Maybe that is something to think about. But I think often there's that debate that should we collect from Peter to pay Paul? Should we collect from the rich people to pay Paul to go on public transport? But I'm sure that is something we find a way around it. So, Joanna, please, if you don't mind, would you want to share some innovative strategies that you think can be implemented on public transportation to make sure it's still affordable, especially for the low income individuals and families? Maybe you can share some experience from Namibia to see to what you are doing to make sure that public transportation is still affordable.
Yes, thank you once again, Doctor. So before I get to the strategies,
Yeah,
perhaps I can just give a little bit background
please do.
to what led to that. So, uh, and also perhaps to commend, our government for realizing the need to have uh, a sustainable public transport system. So in 2013, our government developed what we call the Sustainable Transport Master Plan for Windhoek, that is the capital city where we live. And the focus of this plan is actually to provide a sustainable transport modes we are looking at now: public transport, and
Yes.
also what we call non-motorized transport network. So we are looking at pedestrians, for those that can just walk safely, because not all of us need cars to access a clinic, for example. If a clinic lives closer, I would just need to walk safely. And then also those who would want to cycle. And another focus of that plan was also to reduce uh, 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 carbon emissions. As you all know that, transport contributes mostly to carbon emissions. So when we talk of NMT, for example, these walking and cycling, these are safer and they are considered to be greener modes. And they are also then affordable when we are talking about equity. So with this plan now, one of the recommendations was to have a proper public transport bus service, and that is where we come in now. This bus service provides mobility to mostly the low-income people to access basic services such as clinics, universities for scholars, uh, and other basic public goods. I'm not so sure how many of you know how Windhoek is, but the way the city was planned during the colonial era, it was planned in a way that, you have the employment centers at the other side of the city and the residential are at the other side. So people will need to travel.
Drive. Mm.
So so with that, government has realized that we need to do something. We need to modernize our public transport system. And with that modernization, they brought in a new fleet. Partly, not we did not replace the entire fleet, but we brought in a new fleet, which offers low floor, comfort for our passengers, and also taking into consideration access for our people with disability. It's very, very important that public transport should offer universal access. So it should not leave people out, especially those with any disability. And as part of that, then we looked at technology, what technology can do, in the 21st century, and also with the emergence of COVID some years back. It taught us some lessons that we need to change the way we do things. So we have employed strategies such as deploying, tracking systems in our buses, just to ensure that our passengers, their safety is ensured. Because with a tracking system, you are then able to locate your buses,
Yeah.
and the movement of your buses, thereby ensuring the safety of your passengers and also of the drivers.
Mm.
So those are some of the safety measures that the technology made it possible for us to implement. And then
That's
recently, as Doctor, you mentioned that you came to know me through the new project that we are just busy with now. We
yes.
are
Tell us
with
about that.
Yes, yes. We are rolling out a new, what we are calling the contactless,
Yeah.
cashless. So again, if I have to go back to COVID, we have learned lessons that, as operators, you would not want to have cash as a payment option. Number one, is no longer safe. It can, contribute to the transmission of certain diseases, and also it takes time for passengers to just queue up to pay, get change, or to, it's a lot of hassles. So we looked at what technology has in place, and also to improve the experience of our passengers. So we are busy now rolling out the contactless payment solution in all our buses. So very soon, our residents will no longer have to worry about carrying huge amounts of money all they have to do is make sure that they have a card, a smart card, or they can use their mobile phones to also just use the public transport service. I might be up, Doctor.
Yeah, that's fine. Thank you so much. I was so happy that you mentioned that contactless because it's something that I think COVID has shown us is very possible, and it's nice to see African countries also getting involved in this technology. I just did a study on the contactless card in Lagos, the Cowrie card, and it shows that yes, there is a lot of prospect, and it's something we need to acknowledge. So thank you so much for sharing that with us. Going on, and we also push the next question to Tokunbo. You are very much involved in this public transportation, especially with your role as the co-founder of Eonsfleet. Please, can you share some insight into how you think public transportation system can be made more accessible to people with disabilities, ensuring that they have equal opportunity for mobility? I've done a bit of research on this, so I know the answer, but I won't tell you. So I hope you have something to
All
say.
right. All right. Thank you so much, Doctor, and thank you for all our listeners. So, in just 3 minutes, I will do justice to this. But before I
Yes.
go into the strategy, I would just like to share an abstract. And it was the outcome of a questionnaire that was shared amongst disabled in a place called Kwara State, Ilorin town in Nigeria. So it was served following the persistent outcry of disabled persons over the non-accessibility to public transport facility in the town, Ilorin, precisely in Nigeria. And this study examined the plight of these physically challenged commuters in accessing public transport facility in that town. And about 201 disabled commuters were assessed, and the facility condition inspection also was used to evaluate accessibility and user satisfaction. And this is the result of the study. Male disabled person traveled at relatively high rates of about 76.10% compared to the female folks at 23.90%. Now, the common disability among these disabled persons was physically disability at the rate of 77.1%, while visual disability was about 22.9. The travel demand among these disabled persons showed that the teenager and the adult traveled at relatively higher rates of 10% and 84% respectively. So if you look at this number, we will realize that we have this huge number of people in this ecosystem that we should attend to, we should pay attention to. Now, so for me, I quickly had to put a little bit of strategies around from my research and what I've seen over time. The first thing we need to talk about, and I need to commend what the Lagos State government, Lamata, and the team are actually doing to making sure they make public transportation, convenient and accessible to every Nigerian. But there are things we need to pay attention to. The first one is accessible infrastructure. There is need for us to know because most of the buses we get today, if you look at the facility need, you will find out that it is actually not focused, or the disabled ecosystem or subsets are not being considered. There is need for us to put into consideration the infrastructure. We must ensure that the transportation hubs, the stations, and also the vehicles, the buses are designed with accessibility features, such as the ramps, the elevators, and the wide doors. Is very important. Then, secondly, there is need for us to increase the number of wheelchair accessible vehicles in the fleet. If you look at the number of fleets we have, especially in Lagos, Ibadan, Abuja, Kano, and the likes, do we really have a good number of wheelchair accessible vehicles? And also to that, we need to train drivers to assist passenger. Several times I just drive along. When you see some of these buses, you will find out that it's so difficult for these guys to access public transportation. Even the downfalls, they don't even accept a man on crutches if you study very well. So from these figures that I share with you, you realize that it is not just the wheelchair that we need to consider in the vehicles. Also, there is need to provide audio and visual announcement for passengers with visual and hearing impairment. So it is very important we consider this set of people, so that we can make public transportation more equitable. Also, we need to prioritize seating. We need to designate priority seating areas for passengers with disability. The next one is the staff. There is a need for us to train transportation staff to assist passengers with disability, providing support and ensuring their safety. We are talking about safety for all. We are talking about
Mhm.
accessibility for all. So we need to factor this into consideration. And like the previous speaker said about the payment in terms of fare, we need to make sure we make the transport fare affordable and discounted for at a discounted rate for passengers with disability. It's a way of showing love to them. It's a way of showing that yes, they are in we factor them into the policy we make. The Lagos State recently just presented the transportation policy to guide transportation in Lagos, and I've been going through this document for the past 3 days now. And these are things I feel we should include in some of the policies, and we should find a way to implement the strategy. Most times we know the strategy, but implementing the strategy itself is the real work in here. So to add to this, I would like to say there is need for community engagement. We need to engage with disabled advocacy groups. We need to understand their needs and their concerns. So while making policies, while making strategic decisions, they need to be part of the decision and policy maker, so to speak. So it is very important, and that leads to the next one that I call inclusive planning. There is need for us to involve them. We need to involve
Yes.
people with disability in the planning and the design of the transportation system. Definitely we should. It's a must, so that we can make public transportation for all, mobility for all. It's very essential. And lastly, we need to. I was in South Africa last year, and one of the speakers said something, and I drew this point from the speaker. The speaker said there is a need for us to regularly monitor and evaluate accessibility features, making improvement based on feedback from passenger and disabled people. There is a need for feedback, and that is one thing we need to pay more attention to. Also, as Nigerians, as Africans, there is need for us to create a feedback mechanism, so we can know what people, how best they are enjoying the facility, if they are comfortable with it. And this helps us to re-strategize and making sure we make mobility for all. Thank you so much.
That's fine. Thank you so much for sharing this insight. I guess I like your idea about working with charity organizations, the NGOs, working with people with disabilities to really understand what they need. Well, I think we've really covered a bit of point around that place. So before we proceed to the next part, can we just check if there's any questions so far or any comments before I hand over to Tokunbo to continue with the co-hosting? Tokunbo, the floor is yours now.
Okay, thank you so much. So we go to the second phase, and we'll make sure we keep to time, 3 minutes per
Yes.
speaker, so we can have contributions from the listening sector. All right. So quickly, without wasting time, we will go straight to the second phase, and I will start my question by asking Dr. Emmanuel. Dr. Emmanuel, talking about public transportation, how can public transportation agency collaborate with local community? You will agree with me that it's very essential. Collaboration is very essential here. So, how can public transportation agency collaborate with local communities and organizations to identify and address specific mobility needs within diverse neighborhoods? In just 3 minutes, can you share your insights? Please.
Okay. Thank you so much. I think I will continue from where you stopped and to recognize perhaps what the Lagos State government is doing. And also, like as Johanna has also spoken, this is also where we see that public transport agencies are doing their best. But for me to expand on this, I would quickly share one of my research, which I describe the service provision environment. And this is where we call for audit to actually engage with the community, especially with regards to last mile, because that is an issue whereby often people don't really talk about. They think is getting from point A to point B, but the whole issue is how do you get to the station, if you know what I mean. How do you get to the bus terminal? How is the road? So for example, somebody who is visually impaired, he has to cross the road. He can imagine there are open, what do you call it, gutter? Yes, please give me a better word. Yes, but you know what I mean. You have this open drainage, you have things going on around which might not even be the real job of the public transport agency, which is waiting for them at the major bus terminal. So it's about the last mile and the engagement for people to start taking action and responsibility. So perhaps this is where we will have a call for corporate social responsibility. Maybe not public transport agencies themselves doing that, but again, it could just be an organization who says, you know what, we will improve the community. We will do this to make sure that yes, this transport and this infrastructure is there. And ultimately, we need to know who's responsible for what. Because when we say public transport agency, do we refer to maybe Lamata, the government, or do we refer to the transport service providers? Because again, often people try to shift that responsibility, saying, "Oh, that is for government. The government has not told me to do this, so I won't do that." So it's about having that balance. So just to round up, we need to think about the first and last mile. We need to think about that regulation. We need to think about the audit to look around and just imagine